Hello, my name is Nana Mokhtari, and today is September 4th, 2019. Today we're going to talk about the skeletal system. It is made up of four main components composed of fibrous mineralized connective tissue, which include the bones, ligaments, tendons, and joints. The skeletal system has several functions such as support, mineral storage, blood cell production, protection, and leverage. There are 206 bones in the skeletal system, which are subdivided into 5 categories based off their shapes. These categories reflect not only the shape but also the function of the bones in the skeleton. The categories are flat, long, short, irregular, and sesamoid. Flat bones aren't necessarily flat though. Most often they are thin and curved. For instance, the flat bones include the cranial or the skull bones, the scapula or the shoulder bones, the sternum or the breastbones, and the ribs. Flat bones serve as points of attachment for muscles and often protect internal organs, such as the thoracic cage protecting the heart. A long bone is one that is cylindrical in shape, being longer than it is wide. Keep in mind, however, the term describes the shape of the bone, not its size. Long bones are found in the arms, humerus, radius, and the ulnar, and in the legs, femur, fibula, and tibula, as well as in the fingers, the metacarpals and the phalanges, and in the feet as the metatarsals and phalanges. Long bones function as levers. They move when muscles contract. A short bone, however, is one that is cube-like in nature, being approximately equal in length, width, and thickness. The only short bones in the human skeleton are in the carpals of the wrists and tarsals of the ankles. Short bones have a function of providing stability and support as well as some limited motion. An irregular bone is one that does not have as easily characterized shape and therefore does not fit in any other classification. Most irregular bones have very complex shapes, like the vertebrae that supports the spinal column against compressive forces. Many facial bones, particularly the ones in the sinuses, are classified as irregular bones as well. Specifically these areas. A sesamoid bone is small, round bone that, as the name suggests, is shaped like a sesame seed. A sesamoid bone is small, is formed in the tendons, in the sheets of the tissue that connect bones to the muscles, where a great deal of pressure is generated in that joint. The sesamoid bones have a function to protect tendons by helping them overcome those compressive forces. Sesamoid bones vary in number and placement from person to person, but are typically found in tendons associated with the feet, hands, and knees, such as the patella. Now let's focus on the skeleton in particular. The skeletal system is divided into 2 subcategories, the axial skeleton and appendicular skeleton. The axial skeleton consists of bones of the skull, sternum, and ribs, and the vertebrae. There are 80 bones in the axial skeleton, roughly 40% of the bones in the human body. The remaining 126 bones in the human skeleton make up the appendicular skeleton. This division includes the bones of the limbs, the pectorals, and the pelvic girdle, which guides the attachment of the limbs to the actual trunk of the body. Now let's take a closer look to the actual skull. The skull, as I mentioned before, is part of the axial skeleton, which is comprised of all the bones in the head. The skull contains of 22 bones, specifically 8 that form the cranium and 14 that are associated with the face. Let's take a closer look. The cranium is formed of 8 bones, specifically 1 in the occipital bone, 2 parietal bones, 1 frontal bone, 2 temporal bones, 1 saphenous, and 1 ethmoid bone. The face is comprised of 14 bones. The maxillae, the palatine bones, the nasal bones, the inferior nasal conchae, the zygomatic bone, the lacrimal bones, the vomer, and the mandibular. Now let's focus on my future goals. In the future, I hope to be a neurosurgeon or a neurosurgical PA. In this respect, the skeletal system is important to these professions as knowledge of the skeletal system, specifically the skull, plays a vital role. As a neurosurgeon, you must understand the bones of the skull to understand where to make incisions or drills to reach the area of disease, whether it be a brain tumor, a hemorrhage, or an infarct, in the least pervasive way possible. For instance, if a patient has a brain tumor in the temporal region, one would make incisions near the temporal bones rather than the parietal or frontal bones. Thank you so much for listening. Have a wonderful day.